Today we are going to be administering ketorolac to Jonah Dinerman, and the first thing I'm going to do is I'm going to gather all of my supplies. I already logged into my MAR and I've seen the orders, and I'm going to gather my supplies, and this is ketorolac 30 milligrams per milliliter, and it looks like we will be giving 15 milligrams today, so half a milliliter. This is my first check of the medication. So I'm going to grab my syringe, my needle, a gauze pad, an alcohol pad. I'm actually going to grab 2 of these. And some tape. Alright, let's go talk to our patient. Hi Jonah, my name's Briley. I'm going to be your nurse today. I'm just going to go ahead and take care of and close the curtain. Jonah, today we are going to be administering ketorolac for the pain that you've been having. Can you tell me, do you have any allergies to any medications? No, I can see here on your chart that you do not, so that's great. Jonah, this medication is ketorolac and is for pain management. It's kind of like ibuprofen, except for it's a little more powerful. So the special nursing considerations are I'm not going to give this with any anticoagulants because it can increase the risk for bleeding. The reason we are giving this is for pain. Let's see. The adverse effects that we might experience are going to be nausea, vomiting, diarrhea, dizziness, drowsiness. The action is for pain management and is an anti-inflammatory, and the safe dose ranges are 15 to 30 milligrams. Sorry. Let's see. Yes, 15 to 30 milligrams, and we're going to be giving 15 milligrams today. So the first thing I'm going to do is I'm just going to do some hand hygiene and put on some gloves. And I'm going to prepare my medication. Alright, we're going to go to the MAR really quick. And then this is my second check while I'm preparing this medication. And I have ketorolac, and it'll be 15 milligrams, and this is a 30 milligram vial. So we are just going to be giving half a milliliter today. Just gonna get this all ready. And I'm just going to clean the hub. Let it dry. And then remove the cap. It's going to be half a mil. I'm going to do this a little different. There we go. Okay, so we have half a milliliter there. I'm just going to recap using the one hand scoop, being careful not to bend. Alright, and then I'm just preparing the medication for one patient at a time, and I'm going to bring it right to the bedside with me. Okay, Jonah, here I have your ketorolac that we're going to give you for pain. First, what I'm going to do is I'm going to identify my 6 rights. I have my right patient, my right medication, which is ketorolac, my right dose, which is 15 milligrams, my right time, which is now, my right route, which is going to be IM, intramuscular, and my right reason is going to be for pain. And at this time, I would conduct a pain assessment. Jonah, what can you tell me about your pain? Can you describe your pain for me? Okay, and how would you rate it on a scale from 0 to 10? 0 being no pain, 10 being the worst pain. It's pretty bad, 9? Okay, all right, well, let's get this medication. Let's get you feeling better. Okay, and then I'm gonna go on to my third check. And I'm gonna scan the patient's barcode. Perfect. And now I'm going to scan the medication barcode. It fell off the bottle, that's okay. Perfect, and we have the right dose, the right route, the right time, and that was my third check. I have completed all of my check. All right. Okay, Jonah, can I just have you state your full name and your birthday for me? Okay, that's what I've got here. All right, so now what I'm gonna do is I'm just gonna prepare the site to give this medication, and we're gonna be doing it in the deltoid muscle here, and we're gonna find the acromion process, which is here. We're gonna go 2 fingers below it, and I'm gonna just wipe the area in a circular motion going outward. Okay, and then I'm gonna let that dry completely before I administer this medication. Let's see, it's just taking its sweet time, isn't it? Okay, now that it's dry, I'm gonna uncap my needle. And I can actually just throw this away because I will not be recapping. And I'm gonna hold it between my thumb and forefinger and put my hand using the Z-track method. I'm gonna insert it like a dart at a 90-degree angle. Ready, Jonah? Little poke. 1, 2, 3. Perfect. I'm gonna grab it here and inject slowly, about 10 seconds per milliliter. Okay, and I'm gonna pull it out quickly at the same angle. Put the safety on and then put it in the sharps, and then apply some gauze with a little bit of pressure. We have some tape here. We'll just tape it on here so it doesn't go anywhere. All right, there we go. Okay, Jonah, let's get you comfortable again. Okay. All right, and I'm gonna remove my gloves and perform hand hygiene. Okay, Jonah, I'm gonna come back in about 30 minutes to make sure that that's working, helping with your pain. And then I'm also gonna come back in about 2 hours to assess the site to make sure that there's no bruising or any stiffness of the muscle. Is there anything that I can do for you? Do you have your call light? Yes, you do. Okay, Jonah. I have been through my 6 rights. I've been through the effects of the medication. I've done my 3 checks. I administered, and now I can document it and do my patient teaching.